DHMOSH public DHMOSH Public Health Conversation series that we just started and launched recently. So we are from the Division of Healthcare Management and Occupational Safety and Health, and I'm in charge of the public health section, and we focus on health and wellness, health promotion, as well as infectious disease prevention like COVID and things like that. So as part of the whole idea of promoting health and wellness among staff, we decided to do this conversation series with experts on specific topics. And we invite all staff around the world to join us, to listen in, and to be part of this conversation. So for today, we are focused on the topic of sleep better and live healthier. To join us, we have Dr. Ari Schechter. Dr. Shechter is Assistant Professor of Medical Science at Columbia University, and his doctoral training was in neuroscience with a focus on sleep and biological rhythms, which is exactly why he's here to share with us today. He has done a postdoc research fellowship looking at how sleep is related to food intake, physical activity, energy, body weight, and his research right now focuses on sleep disturbances, how it affects our cardiovascular, metabolic, and psychological outcomes, as well as how light impacts sleep and mood. And he's looking at how to develop therapies that's focused on light to improve sleep and physical outcomes as well. He's conducting studies funded by the US federal government that looks at how sleep duration is associated with stroke and cardiovascular risk, as well as another study on how sleep disturbance is related to psychological burnout and elevated blood pressure in healthcare workers. So without further ado, I just wanted to pass the floor over to him. But before that, just a few housekeeping rules. The way we usually do this, and this is why we call it a conversation series, is because we will start with maybe a very, very short presentation from the speaker. And then, he and I will take part in a kind of a dialogue where I'll ask questions, and it's very informal and conversational. And then at the last half of this, we will look at some of the questions that come in on the chat and see if he could help answer some of these questions as well. So to start off, Dr. Ari, over to you, and just tell us anything you like about yourselves, and then just an opening presentation. Thank you so much.
Okay, thank you. Thank you, Dr. Finn, so much. It's really a great honor to be here. And we were watching before we started, all of the people putting in the chat the countries and locations that they're in, really around the world, and it's really fantastic. So it's an honor to be here. And hello to everybody. I'm in New York right now, so I know that there's times time is all over the place. So if you stayed up late to catch this, if you woke up early to catch this, hopefully it'll be worth your time. So again, thank you very much. And my name is Ari Schechter, and as was mentioned in that nice introduction, I'm an assistant professor at Columbia University, and my work mainly, over time has shifted gears a little bit. I started doing real sort of basic science, looking at the fundamentals of sleep and biological rhythms, and then moved into more sort of clinical cases of how sleep affects things like obstructive sleep apnea and cardiovascular disease, and now psychological disturbance. And I think really the main thing is just, we always emphasize that sleep is universal, right? And everyone does it. So it's really important to emphasize it. And to, if we optimize our sleep, we can really have optimal health outcomes. Okay, so just another comment that I do have this brief introductory lecture here. And then I do have slides that were prepared for the conversation part, and it's just slides really to aid as sort of visual aids for everybody, because I know that some people it's helpful to see things laid out rather than just verbally talking about it. So let's begin here. Okay. So here's the first slide, and these are some images that were taken from a recent book from Dr. Meyer Krieger called Sleep in Art. It's a really lovely book, and it's showing across depictions of sleep in art throughout time. And this is really just to show, right, that this is a nice depiction that sleep is, of course, it's a fundamental biological need, right, like eating and breathing. And sleep is also truly universal, right? So everyone sleeps regardless of culture, national origin, across the whole of human history, of course, right? So sleep is really universal in some ways, and it's something that unites us, right? So I thought it's important to think about given this thing here, right? Although, on the other hand, it's really important to note that sleep is being increasingly recognized as a human rights issue, right? And discrepancies in how different socio-demographic groups sleep really highlights disparities in health, right? So. Okay, so I actually did have the opportunity to see some of the recordings of earlier talks in this series that preceded mine, and including one from my esteemed colleague, Dr. Keith Diaz at Columbia University. And it was very gratifying to see that the first talks in the series were on diet and followed by physical activity and now sleep, right? So really sleep is among these three pillars of good physical health, along with nutrition and exercise, as I said. So each of these three are related to each other, and each influences each other. And again, by optimizing each of these, including sleep, which is sometimes, emphasized less than diet and physical activity, you can really maintain the optimal health. Okay, so this is just some sort of historical perspectives a little bit. And so we all, of course, know what it looks like when someone is asleep, right? You lie down, close your eyes. It looks like this is typically what happens. It looks like nothing really is happening. And in fact, for many, many years, people thought that sleep was close to death. And you see these comparisons of sleep to death going back, thousands and thousands of years. And this continued up to the modern era in physiology and medicine. And this is just one example here from Robert Macnish in an early medical text of the sort of early modern era that called sleep the intermediate state between wakefulness and death, right? But now, fortunately, we know that this really is not the case, and sleep is not like death, right? Even though behaviorally it may look like that. So sleep is really a dynamic and actively produced brain state with accompanying changes to our physiology, right? Sleep is not purely static or passive, and you don't completely or simply turn off during sleep, right? I think it's important to emphasize. Some brain regions are more active during sleep than wake, although it's true that some brain regions are relatively less active. And some hormone systems like growth hormone and melatonin, for two examples, are selectively secreted during sleep, so secreted more during sleep than during wake, although it is true, again, that some hormone systems are sort of reduced. Okay, so here's a summary of some of the different stages of sleep, right? I mentioned that sleep is dynamic, right? It's changing across the night. So what happens, right? And as I said, sleep is fundamentally a brain state, right? That has impacts for our physiology and interacts with our physiology. But as a brain state, we measure it the most accurately and quantify it by examining what the brain is doing. And by looking at what the brain is doing, you can classify sleep into different stages that are described, that are based on the waveform of neuronal activity of your neurons in your cerebral cortex, right? And that's, you can see it on the EEG, which is shown here. And so we have these different stages of sleep, right? Stage 1 sleep is very light sleep, and this is sort of the transitional stage from wake to sleep. And it happens, as you're falling asleep at night, you can sort of drift in and out of sleep, and you awaken early, and you can sort of notice this, right? When you're in this stage 1 sleep, right? It's sort of this woozy, state, transitional state. And often we have what's called the hypnagogic jerk, right? Which is that sense of falling, followed by a sudden, muscle contraction or jerk. That's very common to happen in that stage 1 sleep. It's not pathologic. It's not anything to worry about. It's one characteristics of that. So that's sort of a transition. And then we go into stage 2 and 2, which is relatively light sleep, but it's maintained sleep, right? We spend about half of our night in stage 2 sleep. And there is a relative lowering of cortical activity, and the breathing and heart rate does slow down. And again, we experience this throughout the night. Then we experience N3 sleep, which is slow wave sleep. And this is really deep sleep. This is the really restorative sleep that we have, where again, you have more of a reduction in brain activity, really synchronization of neuronal firing, right? And sort of a very high awakening threshold. And this is really the restoration of the body, right? Stages of sleep. We'll talk about this a little bit more in a second. And it's sort of that nourishing, replenishing sleep. And then we have REM sleep, or rapid eye movement sleep. And this is a very active brain state, right? And your brain activity is as active during REM sleep as it is during a period of wakefulness, right? And this is when we have most of our dreams are happening here. And we have actually, interestingly, we have a paralyzed body, right? So below your neck, your whole body is typically paralyzed, that you can't move your body during REM sleep. And the idea here is that, you wouldn't be acting out your dreams, right? Okay, so this is called a hypnogram, and this is showing us the variation of sleep across the night of those different sleep stages. So we can see across the x-axis on the bottom is the time across the sleep episode, and across the y-axis on the side is the different stages of sleep, right? Going with the deepening of sleep. And what we note here is that really in the beginning of the sleep episode, right, in the first 2 hours or so of sleep, you have a high concentration of that slow wave sleep, right? This is because slow wave sleep really responds to that sleep pressure, right? If you've been awake all day, you immediately go into slow wave sleep, and that's part of that replenishing of your body. And think about it like if you haven't eaten or drank anything for an extended period of time, and you're given water, and immediately you drink very rapidly and very intensely for a short amount of time to replenish that, right? To reestablish that sort of baseline level, that homeostasis. So sleep is similar, right? And that's really the slow wave sleep is concentrated in the early part of the night. And then as you progress across the sleep episode, you have more and more REM sleep. And it's thought that this REM sleep is involved with, again, as I said, dreaming, and it's a high brain activity. And, likely it's thought that it sort of helps with this transition of your brain from being in a sleep state to being in a wakefulness state. But also REM sleep is involved with emotion regulation and some aspects of learning and memory, right? Okay, so this is really, the prior slides really focused a lot on sleep neurophysiology. But honestly, it's not so useful in thinking about when a typical patient or a typical individual who's thinking about their sleep, you're not seeing what's going on in your brain, right? So from a practical and more real life perspective and a clinical perspective, it's important to consider what you or what the patient or the individual perceives as their sleep quality, okay? And so the first thing that I'll show here is the depth of sleep, right? Is the sleep deep enough, and does it feel restorative, right? And this is probably related to that slow wave sleep that we were just talking about. The next is the duration of sleep, right? Is the sleep long enough, right? And typically the recommendation, we could talk more about this, is at least 7 hours of sleep per night. Is it long enough? Because we know that the short sleep is associated with a host of bad outcomes. And then last is continuity of sleep, right? Do you sleep continuously without waking up frequently throughout the night, without fragmentation? All three of these together are really comprising good sleep quality, right? Okay, so next, and I'll just talk a couple more minutes in this introductory part about circadian rhythms, right, which are essential to thinking about sleep, right? So circadian rhythms are these 24-hour body rhythms that all living animals and organisms have, right? As that we know. And this really comes about because living organisms on Earth have these circadian rhythms so that we can live in a temporal harmony with the 24-hour light-dark cycle of the sun rising and setting each day. And so we have these rhythms to help anticipate these daily cyclical changes in the environment so that we can align things like our metabolism, our activity patterns, our physiology, and our sleep to promote, survival in this environment. And so again, this is things like, hormones that vary over 24 hours, and behaviors and happenings in our body across the 24-hour day. So here's just a couple examples, right, of two hormones. By the way, this is to show that sleep itself is regulated by circadian rhythm, right? And so you feel sleepy at certain times of the day, and you feel alert at certain times of the day, right? And this is related closely to these hormones called melatonin and cortisol. Excuse me. So melatonin is often called the hormone of darkness because it's secreted when it's dark out, right? When the sun is down, and it helps our bodies at night to fall asleep and to stay asleep, right? And it's conceptualized as opening the sleep gate, right? Melatonin starts to be secreted in your body, and you open up the gate to allow yourself to start falling asleep, right? And another hormone that's very important here is called cortisol. And cortisol is often conceptualized as a stress hormone, right? And our cortisol levels spike in the morning, right? Sort of to help us get out of bed, start the day, and they're reduced throughout the day and low throughout the night. Okay. And finally, this is the last slide, I think, on this intro part about how these rhythms all have to synchronize to each other, right? So it's sort of like you can think about it as it's often thought of as a symphony orchestra, right? So you've got all these separate rhythms, right? You think about it as the instruments in the orchestra, but really they have to synchronize and coordinate with each other and align to have the best tune, right? And have the best outcomes. So we have other rhythms, and I'm just showing a few here of body temperature as well, right? And really you want, your body temperature rhythm is in alignment with your melatonin rhythm, right? So if the melatonin is going up, your body temperature is going down. In fact, the melatonin seems to help reduce your core body temperature, and that helps you to fall asleep, right? And so the idea here is that you want these all to be in synchrony, and also with your behaviors, right? So you want to be sleeping at night when your rhythms are conducive to promoting sleep, right? But we know this is not always possible, right? We know this happens in shift workers who sleep during the day, and in jet lag, right? When we travel across time zones. So this misalignment of the rhythms can be problematic for our sleep. Okay, so that's all I have for the intro part, and we're happy to take some questions or have a discussion on anything that might not be clear there.
Great, thanks so much, Dr. Schechter. Maybe as a start, let me just just pin our. Let's just make sure we pin. Hang on a minute. Oops. Pin. So I'm not sure. Can you see that both of us? And Dr. Schechter, maybe just take down your screen.
Okay. How do I do this? Should I stop sharing?
Yeah, that's right.
Great.
Great. Thank you. Yeah. Okay. All right, great. So maybe as a start, maybe tell us a little bit about how you actually got into this whole topic and of research and study. I've never known anyone who studied sleep, so I'm just curious to know. Yeah.
That's it's a great question. I love thinking about this. When I give lectures to, I often, I have classes for undergraduates and some graduate students about sleep and things, and I often talk about how I got into this. And I actually got into this because, when I was in high school and growing up, I was interested in science. I loved science, and I loved sort of, thinking about it in science projects, et cetera. And then I started thinking about, things like, these big questions of, consciousness, and, can we use science to answer our questions of consciousness and why we are who we are, and so I was interested in that, and that sort of led me to a neuroscience program in my undergraduate studies. And then as an undergraduate, I wanted to do some research, and I sort of blindly followed a close friend of mine, into a laboratory that he was working in. And this was a laboratory on Drosophila fruit flies, and it was looking at circadian rhythms in fruit flies, actually. And so that sort of, I said, okay, it was just something to do. There wasn't any particular reason why. And then I finished there, and wanted to continue my studies in neuroscience. And then I had an opportunity to join a laboratory in McGill University, and that was studying biological rhythms and sleep in humans. I said, okay, great. Now I'm going to go from flies to humans and learn about biological rhythms. And then that really opened up this door of sleep. Sleep became fascinating. I never thought, okay, this is something I want to spend, my life studying. But it was really looking at this sort of, as I mentioned, like the fun basics of sleep and circadian physiology. And then I started thinking, oh, well, there's so many real life practical ramifications here, right? Everyone sleeps. So many people have problems with sleep, and it's so closely tied into physical and mental regulation, right? So I said, well, this is really something that has a practical, it's sort of theoretically interesting, but it's practically important, right? So that's so happily, I'm able to be in this field that is relevant to so many people.
Great, thanks so much. So my first question is, I've always wondered, why is it that humans need to sleep so many hours of our day? There's so much focus on productivity now, and what we can do. And I've never understood, like, why are we sleeping like a third of our lives away? I just want to hear what you have to say about that.
That's a really good question, and it's the fundamental question. People always think about this and always ask about this. Why do we sleep? Why do we sleep? And why do we sleep a third of our life away, right? I think that's a really good point, a really good way of framing it, right? But it's not sleeping it away, right? It's a matter of perspective, right? And we know, so there's not one simple answer, right? Why we sleep. We sleep for many, many reasons, and sleep is related to almost everything in our bodies, right? Every function, every part of the nervous system, every part of, cognitive and physical functioning, right? So just for some examples, right? We know, sleep is involved. And as Dr. Han, you mentioned initially, there was a real emphasis on how sleep is related to the brain. People thought, well, we only sleep for our brain. And it's true, right? We sleep to help regulate our cognitive function so that we can be alert and vigilant and functioning during the day, thinking wise. And we know if we have problems in sleeping, we have problems in executive function, decision making, we have impulsivity, we have lower cognitive throughput, right? We also sleep to help regulate our moods and our emotions, right? And we know that if you sleep better, you have better, higher sensitivity to positive emotions, for example, and decreased sensitivity to negative emotions and negative stimuli, right? And so sleep is also very, very closely related to all the psychiatric disorders, PTSD, depression, anxiety, schizophrenia, etc. And sleep is also involved with memory function, right? And we know that sleeping, and this is from laboratory studies, right? Controlled studies, sleeping actually causes you to improve your learning and your memory function, right? So that's the brain side, right? And by the way, the vigilance and alertness, right? There was a professor who said one of the most important aspects of sleep is to relieve our feelings of sleepiness, right? It's absolutely true, right? Because if you have excessive sleepiness, you can't really function cognitively, right? And you have risk for motor vehicle crash and things like that. So, but then we also know, and this is really more and more in the last couple decades thinking about how sleep is involved with our physical health, right? So much of my work has been focused on how sleep is related to obesity, metabolism, cardiovascular risk, right? And we know that. We know there's a strong relationship between those. And sleep is also related to immune function. Actually, relevant to COVID, the COVID era, thinking about this, right? Short sleep increases our susceptibility to viral infection, right? And there's also evidence, not from the COVID vaccine, but from other flu vaccines, that better sleep is involved with better responsivity to vaccine, right? And so and we also know that sleep is involved with cancer, right? And there's a strong link there, right, between risk for cancer and disturbances to sleep. For example, also in shift workers, right?
Okay, sounds as if sleep is a therapy for us. I mean, it does so much things. I guess we need so much time to sleep because it's doing so much. Sounds like. But I assume that there's also kind of an optimal amount of sleep. So the other day I was talking to my daughter and she's like, "Oh, Mom, did you know that you need to sleep 7 hours a day? Like you can't do too much and not too little." And I never learned this in medical school. But I'd love to hear your opinion on what's like the right amount of sleep, from research and studies here.
So that's a great question. And again, we say, if you're going to sleep a third of your life away, right? If you're lucky, right? Because and again, I keep coming back to sleep it away. It's not sleeping it away. It's doing a healthful, positive, good thing, right? To sleep, right? That's another thing I wanted to mention, that there was a great lecture that someone gave about a sleep researcher, and he mentioned that sleep is not enough emphasis is paid to the purely hedonic aspects of sleep, right? That good quality sleep can be a very pleasurable experience, right? The act of going to sleep, act of having sleep. So it's also a hedonic thing, right? We should look at sleep as in a positive way. So anyways, to answer your question is the recommendations, the general recommendations, this is based on population studies, is that sleep of at least 7 hours is optimal, right? Typical sleeping of at least 7 hours. This is for adults, right? The numbers are different for children. Children tend to need more sleep. If you're 1 to 2 years old, you need up to 12 to 16 hours of sleep, and then, or I guess if you're 1 year old, about 12 to 16 hours, and going down maybe up to 13 hours when you're 2 to 3 years old, etc. But in school age, 9 to 12 hours. But for adults, it's 7 hours. And there's sometimes they think about putting a cap on it, right? Too much sleep. Sometimes they say 7 to 9 hours, right? And so the question always comes up, well, what is it about sleeping too much that is problematic? And we don't have that worked out as well, the mechanisms of why too much sleep is relating to bad outcomes. But we know there's often this U-shaped curve, right? So that if you're sleeping low amounts, you have increased risk for things like diabetes and obesity and other diseases and mortality. If you sleep too long, you have it as well. And the evidence is much stronger. It's also the mechanistic evidence is stronger for the relationship of short sleep to disease states than for long sleep. So it seems like, if you're sleeping excessively long, it might be due to some underlying condition that's causing the problem. So it's not the long sleep per se that causes the problem, but the underlying condition you might have that's causing you to sleep excessively long. So I think the most recent recommendations are at a minimum of 7 hours, but they don't put it on too much, just because the evidence base isn't quite there.
Okay, great. And then in terms of, hours is one thing, but just like you showed in your graph that, you have light sleep, REM sleep, and all that. So do these types of sleep, do they vary from person to person? Is there an optimal amount of REM sleep versus light sleep? Like, I know I'm a light sleeper. I've been told that and stuff, and I feel that, but maybe it's not true. I don't know. But
Yeah.
Do everyone sleep that kind of proportionally same amount of light versus REM versus others type of
Yeah,
sleep?
so that's another very good question, and it's a difficult question to answer. So we know, again, typically this is a typical sleep profile. Again, you'll spend about 5% of your night, 5 to 10% of your night in that stage 1 sleep, which is the light sleep, and then you'll have maybe 50% of the night in stage 2 sleep, 40 to 50%, and then maybe 20 to 25% in deep sleep and 20 to 25% in REM sleep, something like that. And it's difficult to really apply that to the population in a relevant way, because most people don't know how much REM sleep they're getting, right? So I sort of alluded to this before. And there's some of these wearables, right? Actigraphers that you wear on your wrist, and they measure the duration of your sleep really well, are purporting to tell you about your stages of sleep. And first of all, those are not totally accurate yet, right? They're still working on those. But I sort of struggle with that, because what is a person to do with information that they sleep maybe only 10% of their night in REM sleep, as opposed to the 20 to 25% that classic research studies tell us to do? So, it's difficult to try to turn on your REM sleep, is what I'm trying to say, or your slow wave sleep. So the main thing is, really try to get a sleep duration that is sufficient. And if you have a good duration of sleep that includes good quality sleep, right, that you're not waking up, that's why I showed that sort of triangle of the aspects of sleep. If you're feeling restored, right, and when you wake up and you're feeling that your sleep is restful and not fitful and moving around, and you're not constantly waking up throughout the night having fragmentation, and you're not lying in bed for excess of 45 minutes to an hour or more to fall asleep, that's probably indicative of good sleep. So I urge some caution to people in thinking about their sleep architecture. That's what I was showing with the different stages of sleep.
So speaking about fragmentation, I mean, I noticed that, as people get older, their sleep is supposedly more fragmented, but is that a problem, or is that normal for like older people?
So that's a really good question. I'm going to try to pull up a slide here, because I have a very useful slide for that. Let's see if I can do this quickly. And if I can't, then I'll just go without it. But I think this would be helpful to see. Can everyone see? Can you see that? Okay, great.
Mm-hmm.
So here's a brief rundown across the lifespan, right, of how our sleep changes across life. And we typically need, as I showed you, when at a young age, you need more sleep, because sleep is associated with growth and development of your body and of your brain, okay? And especially that slow wave sleep, right, that I mentioned, that really deep replenishing sleep. So you see, when we're young, we have a lot of slow wave sleep. And as you get older, the duration of your sleep declines. And one of the most characteristic things that happens is you get this reduction in slow wave sleep, and you get this increase in WASO, which is wakefulness after sleep onset, which is what I think you were referring to before, Dr. Tan, this fragmentation of sleep. And this is really showing it as well, right? This is that hypnogram that we looked at. This is a young adult, and you can see there's a good amount of slow wave sleep in the beginning of the night, a good amount of REM sleep, particularly at the end of the night, and not a lot of awakenings, right? Only a few awakenings. And in the older 60-year-old adult, they have very little deep sleep, a reduction in REM sleep, and more awakenings throughout the night, right? So it's normal for this to happen, right? Although insomnia really increases with age, right? So I think the questions are, well, what can you do about it, and what are the consequences of it, right? Oh, by the way, just a couple more things to really emphasize this importance of the biological rhythms in regulating our sleep. When we're younger, right, we have very robust biological rhythms of things like melatonin and cortisol, right? You have a high rhythm, high peaks and low lows, right? And with aging, what happens is those rhythms get a little less robust, right? So your melatonin secretion, for example, you might not secrete as much melatonin when you're older compared to when you're younger. And this can be one of those causes of sleep disturbance, right? Because remember I said melatonin levels throughout the night help us to maintain sleep, right? And help us to fall asleep. The other thing that happens with aging is you have a phase advance of your biological rhythms. So your rhythms actually move earlier, right? So this is very common in elderly. You start to fall asleep, you start to feel sleepy at an earlier time, right? But often you may not want to go to sleep at that early time, right? You want to stay up to, till midnight to work or to be social or to watch television or whatever you want to do, right? So what you'll do is you might end up having sleepiness during the daytime, right? And in the evening, you're feeling sleepy, but you're not ready to go to bed. So that might cause you to have unintentional napping, right? So when you have a nap in the evening or the late afternoon, that might make it difficult for you to fall asleep later, right? Because remember, I talked about that buildup of sleep pressure. The longer you're awake, the more sleep pressure you have, the more you fall asleep. And once you fall asleep, you dissipate that sleep pressure. So if you have a nap in the late afternoon, and then you wake up from your nap at 11, 10 p.m., you're not feeling sleepy to go to bed at 11 p.m. or midnight. So then you might have difficulty falling asleep. That's a characteristic of insomnia. And the other thing, as I mentioned, your rhythms go earlier. So if you're in an elderly person, you might push yourself to stay up later and go to sleep at midnight, but your biological rhythm is waking you up at 5 o'clock in the morning, let's say, very early, right? You can't sleep past that early time. So you end up with a truncated sleep episode, right? Which can also be characteristic of insomnia, right? So yeah, so those are some of the causes there. And what can you do to deal with it? I mean, there's sleep hygiene practices, right? And we can talk more about that sort of separately, but there's some practices like sleep hygiene of avoiding those naps in the daytime can maybe help you fall asleep better if you're having difficulty falling asleep. Light exposure, right, in the daytime, even light exposure in the evening for an elderly person can help you to sort of maybe feel more alert and shift the rhythms back or delay the rhythms a little bit. And even melatonin treatment. I think that's one indication for melatonin treatment is in elderly people who have insomnia. Seems to be effective. But yeah, it's absolutely a problem for many elderly people, sleep disturbance.
So, apart from older adults, obviously young people as well struggle with things like insomnia and all that. And so I'm just curious to know kind of what would you kind of recommend people that suffer from insomnia to do, and also what to avoid, things like coffee, you mentioned naps, both aspects. Yeah. What should we do and what should we avoid?
That's a great, I'm going to pull up the slides again because
okay, go ahead. Yeah.
I think having it written down, because I'll throw a lot of information at you, but really sort of seeing it might be helpful. And so, first thing that we often talk about is sleep hygiene, right? And things like sleep hygiene is, sleep hygiene are practices and habits that are conducive to promoting good nighttime sleep, right? And sleep quality that is good and that can promote good daytime functioning. But I think one important point about sleep hygiene is that it's good as a preventive measure, right? To prevent the development of poor sleep. It's less useful as a way to cure insomnia or cure bad sleep, right? And you can think about it like oral hygiene, right? Oral hygiene won't cure a cavity, right? But it can help prevent the formation of a cavity. So all dentists, right, would promote good oral hygiene, brushing and flossing, et cetera, but they wouldn't utilize it as a treatment for a problem, right? So you think about sleep hygiene and insomnia in a similar way. But it is important, right? So you want to maintain a regular sleep schedule. So going to bed and getting up at around the same time every day, right? Even on weekends and on holidays, right? And that is useful because it sort of leverages your sleep timing as a as a cue, as a time cue to promote that alignment with the circadian system, right? The circadian system with the environment. So you want to keep a consistent bedtime and limit the naps, as I said, right? If you nap too late, that can make it difficult for you to fall asleep at night, right? Your sleep environment, you know, relaxing. Oh, I think someone has other things. You know, dark, relaxed environment. You know, quiet. No light coming in, no noise coming in. And by the way, this is one aspect about how we talk about. This is just one way that there could be discrepancies in sleep health across populations. Right? Not every population has the to have a sleep
Yeah, it's okay. It's okay.
temperature regulated and with no light and no interruptions, etc. Right? But that's part of sleep hygiene, and you know, to have a relaxing pre-sleep routine, right? Things that promote relaxation of your body and of your brain. So we often say to avoid electronic use before going to sleep. There's a lot of this evidence about how light impacts our sleep initiation mechanisms, but it's not just the light from electronics use. It's emotionally arousing stimuli, right? If you're going to look at your phone or your computer right before you go to sleep and read something that's going to upset you or activate you, you know, that could be problematic. And then, as you mentioned, right, there's stimulating activities like caffeine, nicotine, alcohol close to bedtime is discouraged, right? Because alcohol in some people can help you fall asleep, but it relates to disturbed sleep quality, right? And then also adequate light exposure during the daytime, right? And that's a key. If you're sleeping at night and you want to have a good nighttime sleep, if you enhance your bright light exposure in the morning, that can help, again, synchronize your circadian rhythms, strengthen your circadian rhythms, which can help you sleep at night and be alert during the day. And this is a big problem because a lot of people are in this modern era are working indoors and they're exposed to, you know, dim office light all day. And so this can really be a way to a non-pharmacologic way of enhancing our sleep. Right. So then there's other things like cognitive behavioral therapy, which are more psychological and behavioral approaches for full insomnia. And those get a little more complicated. And those are things like, I mean, the one thing that I think I'll talk about here is stimulus control. And this is, as I said here, it's a set of instructions that are designed to reinforce the association between your bed or your bedroom with sleep and to reestablish that consistent schedule. So what happens with insomnia often is that people will have anxiety about the act of going to sleep. It becomes sort of a conditioned response that, right, when you go to your bed, you're calm and relaxed all day. When you go to your bed, you start to have anxiety, right, about sleeping. You think your mind starts racing. And so stimulus control is really about breaking those bad connections, associations, and reestablishing a positive association of your bed with sleeping at night. So you want to reserve your bed for sleep mainly, right? You don't want to do work in your bed, don't want to eat in your bed, you don't want to do anything that's emotionally activating or you know, upsetting in your bed. And you really want to go to bed only when you're sleepy, right? Because then you're going to have a rapid initiation of sleep. Again, this comes back to the napping issue of like why you don't want to have a late nap. And so go to bed only when you feel sleepy. And if you can't fall asleep, or if you are waking up in the middle of the night, this is a key thing. If you wake up in the middle of the night, you're tossing and turning, don't toss and turn for, you know, an hour. Get up out of bed. It's hard. This is a challenge. But get up out of bed. Go to another environment in dim lights, right? And do something that's relaxing, that is sort of drowsiness promoting. And then once you're feeling drowsy, go back to your bed. And then hopefully you will use that, right? Leverage that drowsiness that you have because you've been awake to rapidly fall asleep and stay back asleep. And again, you're breaking that psychological link between being tossing and turning and being upset and anxious and your bed. So those are some of the there's some other recommendations, but those are I think things that people can do on their own.
Great. Thanks so much. Something that we haven't really talked about is really just very quickly about sleep and kind of physical health, as well as like obesity. I hear a lot about that short sleep leads people to obesity. And so just very quickly, before we move to questions, kind of the connection between physical health and sleep.
Absolutely, yeah. So this is obviously, and I'll spare the slides because if I bring up the slides, I'll talk about this for an hour. But there is a close relationship between sleep and physical outcomes, like we said. And a lot of work has shown how sleep is related to obesity, right, and body weight gain. And so work that we've done and my colleagues have done here, really this has been ramping up a lot, has shown that there's observationally, right, people who sleep less tend to have higher body mass index, and higher body weight, and they tend to have more, incidence of things like type 2 diabetes and metabolic dysregulation. And so, so the question is really why, and I think that there's, we've done some mechanistic work in the laboratory showing that when you restrict someone's sleep, it triggers a set of responses to help to promote energy intake, positive energy balance, right? So again, if you restrict someone of sleep, there's certain hormones in our body that are upregulated, that promote our hunger and food intake, and there's certain hormones when you deprive someone of sleep that are downregulated, and those hormones that promote satiety are downregulated, and the net result is that you feel hungrier and you end up eating more food. Right? So there is a pathway there. And what also happens is if you look at what's going on in the brain, while we are sleep restricting somebody, you have activation in certain areas of the brain that are responsive to reward cues, right? So if you sleep restrict someone and you show them a picture of a very palatable, like something that really high sugar, high fat, something really tasty, but not necessarily the most healthful food, they're going to have higher activation in their reward centers in their brain, combined with maybe a lack of inhibition, right? And you might be more prone to go for that, piece of cake after you've already had a huge meal, and then that can promote, the excess energy intake and weight gain. So that's some of the ways that sleep can contribute to weight gain, but also, sleep is related to things like type 2 diabetes, and that can be with, things like sympathetic nervous system activation, and the obesity, et cetera. But then there's also the link of sleep to cardiovascular risk, right? And so sleep is really, as I said, right, if you sleep, it can impact the physiological drivers of cardiovascular disease risk, like hypertension, right? So if you restrict someone for sleep, blood pressure can go up. Sympathetic nervous system can be ramped up. You can have inflammation in your body. And again, that sleep disturbance can cause some metabolic dysfunction, and that metabolic dysfunction can also contribute to the cardiovascular risk. And then to bring it back to, because we talked about diet, but to also bring it back to physical activity, if you sleep deprive somebody, they may be less motivated to do physical activity, right? To wake up and do exercise, and that come with that fatigue and that sleepiness might come less physical activity, all of which can contribute to the cardiovascular risk.
And just a quick question. I mean, these outcomes that you see, these negative outcomes, are they proven in research that it's not just a correlation that is actually causative, or it's just a correlation that you're seeing?
That's a great question. That's a really good question. I think that's why it's important. So that's why it's important to do some of the mechanistic work in the laboratory. And so, yeah, so the first thing that happens typically is that someone will note a correlation, right? A relationship between something like sleep duration, right? Short sleep or sleep disturbance, and a bad outcome, right? Like cardiovascular disease. And that's not enough, right? So you need to work on the mechanisms there, right? So you need to see what is it about short sleep or insomnia that causes you to have cardiovascular risk. And yes, a lot of this work is based on experimental findings, right? So we know that, as I said, right, when you do an experiment, a controlled experiment with a sleep restricted condition and a not sleep restricted condition, the hormones regulating appetite and hunger go up. And that is associated with increased food intake compared to a condition, a control condition where you don't have that, right? And same thing for blood pressure increases, right? We know that when you restrict someone's sleep, the blood pressure increases. And that is a known risk factor for downstream cardiovascular risk, right? So that's how we sort of put the pieces together to show that sleep is a causative factor in these adverse health outcomes.
Great, thanks so much. I'm just gonna put a quick plug for a few programs that we have. So one is that we have a wellness champion program, and if you're interested, please sign up. We're gonna put that in the chat, and through that you're gonna get in the email like about programs like this and other programs. Secondly, we also have the Global Health Challenge, and that's a free app that you can you register and you can download into your phone, where you're gonna track how many steps you take every day, and we have a target of 10,000 steps a day, and then you do this challenge over a few months with your other UN colleagues. You can pull in teams together. So that's the Global Health Challenge. We'll put that in the chat as well. Third one, we have a survey on physical activity. So we just want to know how UN staffers are doing in terms of their physical activity level, whether they're meeting WHO targets. We're going to put that in the chat. And then the last one is that just to collect feedback, every session we have for these talks, we always want to collect some feedback and see how we can improve any special topics that you're interested in. So fill that in as well. But then now I'm going to just kind of quickly move over for the last 5-10 minutes to some of the questions on the chat. So let me just quickly go through. Some of them have been covered already. Are there any kind of concerns about long time night shift work for shift workers who work at night?
Yeah. So unfortunately, there is, and this is another area that I've studied a lot. And so again, so very briefly, what happens with shift workers is they have a misalignment in those biological rhythms with their behavioral rhythms and the outside environment, right? And so they end up trying to sleep during the daytime and be working at night, and so that causes a decrease in vigilance and alertness during the nighttime when they're working. Medical errors and workplace errors, etc., and a disturbance in the ability to fall asleep during the daytime because your circadian rhythm is usually ramping up, causing you to be alert. So they might have very short sleep disturbance. So it's this disturbance in sleep and the circadian system that's problematic for shift workers. I'm sort of rushing through this because I'd love to answer some more questions. And yes, so unfortunately, we know that night shift work is associated with bad outcomes, metabolic dysfunction, obesity, and mental health outcomes, and cancer, as I said, right? There's a very high risk of breast cancer in particular in night shift workers, female night shift workers, because and it seems to be involved with melatonin suppression, right? The suppression of melatonin secretion at night because they're getting light at night when they shouldn't get it. So it's a big problem, and we're trying to study that. And there's a lot of work to promote interventions. Like maybe there's interventions that we can have of, well, maybe you shouldn't eat during the nighttime. This is just a few examples. Maybe you should eat, not throughout the night, but during the day. And how can you promote better sleep if you expose yourself to light at night, but shield yourself from light on your commute home. But yeah, shift work is associated with bad outcomes because of that sleep and circadian disturbance.
Okay, another question about kind of sleepwalking and nightmares. I mean, I assume that's, I'm not sure they're related, but tell us more about that.
Yeah, and I saw because people are fascinated by this, and I unfortunately know very less about this because it's not something that I study. But we know that nightmares. So sleepwalking tends to happen not during REM sleep, right? And so in that way, it's separate in some ways from nightmare. But yeah, nightmare can be very disturbing to individuals, particularly we know post-traumatic stress disorder, right? Sleep disturbance is a hallmark of post-traumatic stress disorder, and nightmare is high on that list as well. So and we know this is a huge problem, PTSD, for combat veterans, but also people who have non-combat traumas, right? Traumas from natural disasters and even COVID, right? We're studying how COVID is producing PTSD in healthcare workers, right? And so yeah, it's problematic, and it's a major disturber of sleep. It can cause sleep-related fear, and also can exacerbate insomnia.
What is your opinion about kind of catching up on sleep? So some people sleep less during the weekday, but then catch it all up in the weekend. Does that actually work or not?
That's another very good question, and it's a complex answer, right? Because in some way, right, yes, you want to make up for lost sleep, right? If you can't get sleep, you want to make up for it, because if you have that decrement in sleep, you have decreased vigilance, decreased alertness, decreased function, and sleeping in, so to speak, is a way to pay off that sleep debt, right? Pay off that sleep need. Now, on the other hand, there is some recent evidence that shows that this changing in the irregularity of sleep is associated with bad outcomes. So changing the timing of sleep, so sleeping at different times each day, and that includes shifting on the weekends, and sleeping later on the weekends, and sleeping longer on the weekends. It sort of creates like an internal jet lag, something called social jet lag, right? And that seems to be associated with some bad outcomes. And there's evidence that even that sleeping in, right, doesn't alleviate some of the metabolic decrements of short sleep. So, our recommendation, the recommendation is always to, try to sleep consistently, right, at the same time, and, going to sleep and waking up at the same time, and the same duration, right, because you want to reduce that variability in sleep. But we know that's not possible for everybody, and so we can to alleviate things like sleepiness, it can be helpful to sleep in.
So how would one kind of reset your circadian rhythm? Is there a way to do it? Someone said that, like, someone mentioned about going into a cave, like, without light and then resetting it. Do you kind of just use light to do it, like sunlight, and then how would you do that, like curtains and stuff?
This is a great question. This is a really great question, and again, I think it ties in the aspects of the biological rhythms with sleep, and it can show you that leveraging the environment and the light environment and your rhythms can be useful to improve your sleep, right? So yes, and I think I know where the person is coming from with the cave, because there was classic experiments that uncovered the endogenous circadian rhythms. But the best way, I think, to enhance, to sort of reset your rhythm is to expose yourself to very bright, to use light, right, as an aid, right, to expose yourself to very bright light in the morning when your body is sort of set up, right, to receive that light, right, and to avoid light at night when, again, your body is not equipped to handle that light, right? The invention of electric light is a relatively recent thing, right? So for millennia, right, our bodies were not receiving bright light at night. And we're receiving this bright light in the mornings because we were out in an outside environment. We weren't in these office settings. So yes, I think that is the key that we can do to avoid light at night, particularly the short wavelength light and bright lights, and to enhance our light exposure in the morning. And you can do this ideally by sunlight, but you can also have things like a light box, right? Full spectrum light, white light from a light box that you can put in your office, right? Because not everyone, again, has the luxury to be able to have a window, next to their office, or to where you can get that light. So you can get it from artificial sources in the morning can be helpful. So yeah, that's how you can reset your clock.
So I have a question that I have to ask you. Do you sleep with the phone next to your bed? Because I've heard that is so bad, but can't help not doing it.
That is another great question. And yes. So personally, I do, and that's not good. And so so I can tell you the research shows that, exposure to these devices before going to sleep can disrupt our sleep initiation, right? And it has to do with the light exposure from these devices, and the blue light, so-called blue light, which is short wavelength light, can be acutely disruptive to our sleep. But I think it also has to do with the emotional content and sort of the content of what we do on our phones, right? So there's a circadian aspect and also a psychological aspect. And so looking at your phone and seeing something that's going to upset you can be disruptive, or thinking about work can disrupt your sleep. And also, this is something people wake up throughout the night, and you grab your phone and you look at it, and you start the whole process over again, right? You get light exposure, which is bad for sleep. You get emotionally arousing stimuli, which is bad for sleep, right? And so the true recommendation is to put your phone away and don't look at it. And I know this is a lot easier said than done, but if someone has sleep problems, I would say that should be the first thing you do, right? If it's something that you're doing, looking at your phone throughout the night, and you're having sleep problems, it's the easiest thing you can do to try to improve your sleep, right? But not everyone is susceptible to these problems, right? There's a lot of, and I saw there was a question in the comments. There's a lot of inter-individual variability on who's susceptible to sleep disturbances and who's going to have these problems. But yes, if you're having issues with your sleep, you should put it in a different room completely.
And our last question, because our time is almost up, but in terms of sleeping pills, a lot of people think that they need to use it to fall asleep, and then they can, there's dependence on that. What are your thoughts about that? I mean, I know you're not a medical doctor, but just, what's the research on sleeping pills and sleep?
Yeah, exactly. So I would say I would have to preface this with the caveat that I'm not a physician, I'm not a clinician, I'm a researcher. But I know based on the work that sleeping pills, pharmacologic aids can be useful for the sort of acute insomnia, right? Dealing with it in the short term, but there are adverse risks, right, associated with sleeping aids, particularly things like benzodiazepines. And so these can, increase risk for falls in the elderly, and they can have some hangover effects. And I think a big risk is dependency, right? A dependency on these sleeping aids. And so we know in sort of the behavioral sleep medicine world that cognitive behavioral therapy for insomnia can be effective in the short term, very effective in the short term for insomnia, and seems to have more impact in the long term as well, right? Can be more effective than pharmacological treatments for insomnia, right? More enduring beneficial effects, right? So in that way, CBTI, right, cognitive behavioral therapy for insomnia, is often thought of as the first line treatment for insomnia. But there's hurdles, right, to getting it. Again, this sort of gets back to some of these discrepancies, right, disparities, right? Who can get CBTI? It's involved, right? You have to have someone has to administer it to you, right? And you have to, and it takes work, right? Also, it's effortful, but that seems to be a very, I mean, it's shown repeatedly to be a very effective way for improving sleep, and it's non-pharmacologic, which is great because it really reduces the risk profile.
Right. So when you say CBTI, it's kind of more changes based on, you know, cognitive, how you think about your sleep versus kind of using medicine and pills for that.
Exactly, and I showed it a little bit with the stimulus control. Is that's part of the behavioral treatment, the behavioral approaches. But there's things like sleep restriction, and you know, there's actually a brief behavioral therapies too, right? Which are just behavioral approaches for insomnia that can be effective. And then yes, the cognitive. If you put the cognitive component, there's sort of a cognitive restructuring, changing your thinking about sleep, that, you know, how you approach, you know, how sleep is going to impact you. But yeah, that's for sure much more of an involved component, because that's going to require more input from a psychologist or a trained sleep therapist.
Mm-hmm.
Yeah.
Great, thank you so much. I just want to again just thank so much to Dr. Schechter for doing this. I just want to say a quick word about some sleep hygiene kind of sessions that our staff counseling office offers. So next Tuesday, there's one over Zoom, kind of as a virtual training session, and then one in July. We'll send that notice out to everyone along with the recording of this, and just feel free to share with your colleagues just to help them improve their sleep. So thank you to everyone for joining today. Thank you, Dr. Ari, very useful. I've never learned and heard so much about sleep, and it's just so important. I think it's just so stated, like how important sleep is to all of our well-being, right? Both mental and physical. So let's sleep well, everybody.
Sleep well, and don't discount it, right? Sleeping can be a pleasurable thing, right? And it's not bad to want to sleep, right? People often have guilt. That's going to be my closing comments, right? We know it's so important for our health, for our mental health, our physical health, our well-being, and people feel bad sleeping. Say, oh, I shouldn't sleep. I should be doing something. But sleeping is doing something, right? Sleeping is very helpful. It's the most effective, you know, self-help thing you can do, right? And to really, yeah, I would like to emphasize that. So sleep well. Enjoy your sleep.
Yep, and to all those who are, it's time for the evening. Thanks for joining us, and sleep well tonight, everybody. And we'll see you the next round in July. We're gonna do something on alcohol and the physical effects of that. So please join us then. Great, thank you so much, Dr. Ari, and we'll be sending out the slides and the recording to everybody soon. Thank you.
Thank you so much, everyone. Take care.
All right, take care, everyone. Bye.
Bye.